welcome to the new normal. This is season 4, episode 9. My name is Mario Vassaux. I'm the COO CTO of Life365. And today we'll be discussing the role of big data and insights in healthcare for better outcomes and just-in-time care. Before I introduce our distinguished panelists, I'd like to remind our audience and participants that you will be on mute, but you'll be able to ask your questions in the chat. And what we'll do is dedicate the last 10 minutes of the webinar to answer as many questions as we possibly can. So again, I thank you all for participating and welcome. Today, we have 2 distinguished guests. I'll start with Michael Lonsway of Calian Health. Michael has 20 years of experience in the IT space. His passion lies in transforming patient care through innovation. He joined Calian in 2000 and has provided leadership to the company with a focus on IT products and solutions for healthcare clients. He helps clients throughout the US and Canada develop robust solutions to help their organizations embrace quality of care, enhance collaboration, improve efficiency, and reduce costs. Calian's open and interoperable collaboration solutions make it faster and easier for healthcare organizations to connect to one another and share critical information that is essential to delivering the highest quality of care possible. Immediately prior to Calian, Michael was a technical architect at Prudential Life Insurance, and he began his career as a consultant with Accenture, where he held increasing roles of responsibilities throughout his 5-year career. He holds a bachelor's degree from the University of Illinois Urbana-Champaign in engineering. Welcome, Michael.
Thank you, Mario. It's great to work with your company and great to be here today. Thank you.
Thank you. And our second guest is Mustafa Al-Durra, PhD. He's a healthcare industry consultant and architect for Microsoft. Dr. Al-Durra is a polyglot, cloud architect, and scholar. In his current role as a worldwide healthcare cloud architect with Microsoft, he enjoys his daily work in developing and implementing interoperability and digital healthcare solutions for the top 500 strategic accounts in the public, education, and private sectors. Prior to joining Microsoft, Dr. Al-Durra worked as a software consultant in Germany and then in Avanade, Accenture, Canada, as a technical architect for many years. He developed and architected software solutions for numerous healthcare projects, clinical trials platforms and pharmaceuticals, electronic medical records, EMRs, radiology, clinical decision support systems, personal health records, Health Vault, HL7, FHIR, and major provincial wait times and electronic triage systems in Ontario, Canada. He holds a PhD in health informatics from the University of Toronto and a master's in information systems from the University of Duisburg-Essen, Germany, and a bachelor's degree in computer engineering from the University of Baghdad. Welcome, Mustafa.
Thank you, Mario. An apology for the long bio. I didn't know you're going to read all of it, so I should have.
No, I wanted to make sure that our audience knew who we were talking to, and also, I've worked closely with both of you in the past, and you're esteemed colleagues and the most professional people I know out there, and have been very helpful in working with Life365. So let's
If I could
move
also
on.
add, right, we've been Calian, we've been focusing on digital health innovation, always deeply aligned with Microsoft as our business partner as well, right? And so we look at what Microsoft provides, with their cloud platform and other technologies, and we're always looking to innovate on top of that, with our healthcare solutions and services, right? And even Mustafa and I, we go back about 10 years as partners and friends, and Mustafa, maybe we can even weave together some of the success stories we've had together as companies, but also just as friends as well, right? So I'm honored to be here with both of you.
Honor is mine, Michael and Mario. Thank you.
Thank you. So we're here to talk about big data and its effect on healthcare and the health systems that we all work with. So in just kind of a definition, big data, it's really the collection of tons and tons of information that is being used throughout the world to provide care for patients. In our cases, we're collecting biometric data. In Microsoft's case, in Azure, they're working with databases that contain billions and billions and billions of pieces of data regarding demographics, user information, with their cloud for healthcare that they have now entered the digital healthcare space. So all of this data that resides out there, at the end of the day, we're going to ask some questions today. So, how has it been used in the past for the use in healthcare, the betterment of outcomes, and where are we going in the future? So with that, I'd like to give each of our panelists an opportunity to give us some thoughts on how they've used it in the past. And we'll start with that. I'll start with Michael. I'll start with you.
Sure. Okay, thank you, Mario. So we've been focused on innovating in healthcare IT for more than 20 years now, right? And at the core of our business, we focus on data integration and interoperability, right? And around that, we layer our solutions like virtual care, patient engagement, custom development, data analytics, all those kinds of things, right? But really, at the core, it's always been about healthcare data integration, right? Historically, that has been more about how you connect systems within the hospital or the health system, right? And looking at some of the well-established but dated standards like HL7, V2, and I live in Canada, and most of my experience is Canadian, but we've done some things with HL7 V3 and those sort of things. But it's been talked about as change and modernizing, but really in the past couple of years have really seen a lot of acceleration towards new models of integration, new models of interoperability, which are really focused on integrated care delivery, care coordination, right, and really bringing data together to help clinicians have a more meaningful, holistic picture of the patients, but also being able to give patients better access to the data about them, and really that kind of whole shift left, right, moving towards reactive and encounter-based healthcare, right, fixing problems when they come up, and kind of shifting that left to, with a greater focus on wellness and health and well-being and those kinds of things, right? So very excited to see that, right? And I think, the new, standards of interoperability like FHIR, and certainly, cloud technologies like Microsoft Azure and all the great capabilities that they have in the Microsoft Cloud for healthcare, really are an enabling platform, right? So, I live in Ontario, and certainly we're seeing a lot of the same things happening globally, but in Canada and in Ontario, there's a big focus on regional care coordination, right? Can we really get the acute care, the specialized care, the primary care, and even beyond that, get into community services, right? Things like transportation and Meals on Wheels and those kinds of things, right? And how do you bring all those people together, and they all have different systems and different ways of working, but how can you integrate all those different organizations and different systems to provide at least some degree of better coordination and integrated data to support sort of more coordinated care across the continuum, but even more importantly, more coordinated care for patients, right?
Right.
And certainly, we're very excited to be working with a lot of the Microsoft Cloud technologies and the Microsoft Cloud for Healthcare. We see that providing a fantastic standardized platform, and maybe I'll segue over to Mustafa to provide some more color there.
Thank you, Mike. Thank you, Mike. And I can't agree enough. I think what we see in the field, first off, maybe a word about the team I come within the healthcare service line in worldwide Microsoft. I am a neighbor of Michael, so I live also in Ontario in the Toronto area. But the team I work with is more of a global team. So we look at large scale enterprise level of our healthcare customers, and we try to help them with our platform through our solutions and through our partners. And Michael and Mario are great examples of how a successful partnership can really work in our context. In terms of the healthcare data platform or the healthcare solutions we bring on top of our cloud, I think there is some of it that is patient-centric, some of it that is provider-centric, and some of it that is payer-centric. Though more and more we see these are pretty much the cliches. This is how the healthcare delivery system has been designed, evolved, segmented over all the years we've been around. Lately, of course, the life and science, the research is really picking up more momentum by virtue of data sets we are now able to collect and maintain and protect in the cloud. So there is a little bit more of a shift, at least at the data level, not at the application level. How I can, as an organization, now I have a wealth of data. How can I operate that data? How can I classify, govern those data to first of, get the insight? What is the story that the data is telling me? And second, inform my, what's my next best action based on the insight I have? What is the action I could move forward with to give me, the best return I'm looking for, whether it's a clinical outcome return, a financial return, operational optimization return, either of these cases. So the verticals and the dimensions of what can be approved based on the data sets we have, it's really going beyond, the classical use cases, which is how can I provide the data to my patient, at the fingertip? How can I improve my providers, my physicians' workflows? Or how can I improve my membership in a care plan? How can I improve the data exchange on that? So I think that's probably still a foundational use case we have in our market today. But again, I think what I feel a little bit more excited is about what the future holds, how we could collate all these data sets together to drive insight and vision into informing how to move forward.
Great.
If I could build on what Mustafa is saying, right? What are some of the solutions that we're working on with our customers, and where we see a lot of great opportunity for the Microsoft Cloud for healthcare in particular. Again, coming back to that whole shift left is sort of bringing that proactive and predictive case management approach to healthcare, right? And this is a big push in Canada and certainly in other parts of the world as well, right? Is focus on the highest risk or the highest needs patients or citizens, right? And then how can we sort of identify those target populations and bring a very proactive support system, right? And sort of case management platform, which includes the tools like dynamic CRM and some of those things which are can be very heavily customized for healthcare, but also combining that with data integration from all the different providers that operate in a region or province or a country or whatever the case may be, right? And and this is a big push what we're seeing in Canada, just the examples in Ontario, what we're focused they're focused on just as examples, 4 major areas, right? Congestive heart failure, diabetes, COPD, and stroke, right? So looking at who are these kind of frequent flyers or high consumers of healthcare resources, and how can we bring a very proactive approach to identify them and support them and help them with a greater focus on maintaining their health and well-being, and try to keep them on the acute care system, right? So
right. So one thing in common that you both have said is being able to take this vast amount of data that's being collected and making it granular so that it actually addresses and focuses on very specific areas. So for example, care coordinators have a view of the data that's coming through that's actionable, right? So they have now an opportunity to act on behalf of the patient to help them through their, let's say, chronic illness, and to provide better outcomes there. But it also gives the patients themselves the ability to care for themselves, right? And to, as you mentioned, not only maintain their health, but also give them insights on what corrective actions they may need to take, right, to improve on their health outcomes. So it's really interesting. People don't realize that they have their Apple Watch, their Fitbit. All of those devices are collecting pieces of data. Every day when you go shopping, there's data being collected on what your groceries are. And in essence, one question I have for both of you is, sometimes when the term big data is bandied about, it strikes fear in the hearts of consumers, right? And so tell me something just as a question is, how do you mitigate this fear of big data, in your organizations?
Well, I think, with all of our solutions, we work very, very closely with our customers to listen to their needs and provide very highly customized and integrated solutions based upon what we hear from our customers, right? The clinicians and even patient focus groups, those kinds of things, right? And looking at big data, it's really about how you bring it all together in the right way, right? And this is where Mario, we're super excited to be working with your team, for the remote patient monitoring and the Bluetooth enabled in-home or at least in the community medical devices, and and that's a very important part of the overall trend towards how can you get patients sort of through the hospitals and back into the community faster, but at the same time, if you're moving them back to long-term care or in their home, right, how can you maintain that hospital-like level of connectivity, right, through the remote data? But then it's what do you do with it, right? And that's always been our focus in terms of how do we pull together different pieces, right? And so we're very excited to be pulling together the the biometric data that comes from your platform and all the 300, 400 Bluetooth enabled devices that you support. But then we're combining that with Microsoft Teams, right, and our solutions, right? So Microsoft Teams as a very robust and trusted virtual care platform for secure individual virtual visits, group visits, secure chatting, and and provider to provider coordination. But then also combining that with data from all the existing clinical systems that are in our customer, right? With their their hospital information systems like Epic, Cerner, Meditech, it's sort of bringing in specialized scheduling, appointment data, bringing in patient visit history, bringing in the family medical history, all those kinds of things, right? But bring it together in a super easy to use way, right? We focus on Teams as a familiar platform for many, in fact, maybe the most healthcare customers today, right? So we start with something that's familiar, but then we bring our solutions on top of that to bring data integration, bring the patient data, bring the appointment data in, and make it very, very easy to work with in a seamless, integrated way, right?
So it's really about taking big data and making it accessible, right, to all of these different groups. Mustafa, any thoughts on that?
Yeah, I think it's important to also mention, many of the technology we provide in our cloud and the services we have, they really lend themselves very well to an enterprise level environments. What I mean by that, if you look at the most famous and most promoted hashtag these days everywhere we go is the chatbot and the large language models. So that's a great example to look at, big data and the exposure and the risk and the responsibility on us as a cloud provider, as a major cloud provider, to adhere and be responsible. So if you look at that example, ChatGPT and generally LLM, large language models, they are trained on large data sets. So if I am an enterprise, if I am a hospital, if I am a healthcare provider, first off, that big data model is not really trained on my data set. Second off, if I will, quote unquote, if I will volunteer my data set, which is not right in many ways, but would you do that, then that model is public, and that's also not how you protect your data. So there is the concept of there is general built, publicly available data sets and models out there, but then there is also enterprise level data sets and machine learning AI models that are purpose built within the organization.
Right.
What I feel super empowered about is more so the latter, because that's how we bring these advanced technologies and not really push you in any way to give away your control of your data estate to be able to use these services. It's the other way around. We bring it down into your tenant, into your Azure environment, and you can train it, own it, lock it down within the environment, And I think that's the best way how you could position that in terms of, the hype around big data and the concerns about the control. And it's always a shared responsibility, right? So there is the concept of the security of the cloud and the security in the cloud, right? So we as Azure, as Microsoft, we're absolutely responsible for the security of the cloud. And you, Mario, from Life365, Michael from Calian, when you implement your solutions, then you are responsible on your solution in the cloud. There is that shared responsibility. And what we do to complement that is really to give you all what you need to make you successful, to finish your part in that shared responsibility model.
Indeed, indeed. So yes, we follow the HIPAA guidelines, for data security for health records. Then we have layers upon layers of other security that needs to be put in there. I think the benefits of using big data and the future in using AI or machine learning to really create additional systems to provide better outcomes is really the future. We may not quite be there yet, but we're very close. I feel it's going to be amazing if we were to wake up and it's a year down the road. The implementation of this use of big data to really create better care management, better outcomes, are really going to outweigh all of the hesitation that the public might have about big data, right? When you think about it, it's really up to us as the systems integrators, the app developers, to create something that's of value to the population. So either for population health in general, with all of this data that's being collected, but reality is, at the end of the day, we're going to get very granular. We're going to focus on the individual. There's the what I call personalized healthcare, right? We're going to be able to offer up solutions to the enterprise and then to the individuals themselves that are going to be of great benefit. Michael, what's your thoughts over at Calian on what's going on with the AI and where you see implementing some of that into your offerings?
So we're just sort of at the early stage of it. Where I was going to go with this, Brian, was from a population health perspective, right? We've done some very interesting work up here in Canada around population health systems, right? Maybe one customer in particular is Born Ontario, right? It's a provincial organization, and they have gathered this vast and rich and comprehensive data set around all the pregnancies and births that happen in the province, right? So there's about 140,000 births that happen every year. There's over 1 million encounters related to all the different, prenatal, labor and delivery, midwifery visits, and including, NICU or even fertilization encounters, all those kinds of things, right? So this very vast and extensive data set. It's one of the top 2 or 3 in the world, actually. And we've worked with this customer for over a decade, and it's one of the top 2 or 3 data sets of this type in the world, for sure, right? They're very well renowned. And so we've seen how they, pull all this data together, and they've got, teams of data analysts and researchers that, work on solving different problems that, sometimes inform the provincial health system to make, better informed decisions. But also, they do make it very personal, right? So there are some key measures that they're focused on, very simple kind of metrics, right? Where, they can understand what's happening across the province, right? Sometimes in the bigger cities, sometimes in more rural areas, or, different geographies or different size of hospitals, small, medium, large kind of thing, right? How they can really dissect it, but then what they do with it, right? So, key measures like, unplanned cesarean sections. And, one that's very personal to me was, mothers that come into the hospital and deliver a baby planning to breastfeed, but that leave on formula, right? Knowing the importance of breastfeeding on, the newborn's health and the ongoing development of the child, right? Where can we provide better supports to hospitals that maybe, and this happened to my wife and myself and my first child, right? Not necessarily be quick to go to the formula, but stay with the breastfeeding. And even though mom's exhausted and baby's crying and all that kind of thing, right? There's lots of benefits to do that. So, it's a very simple kind of outcome just to understand, where things are and how they compare and what are the metrics that we're looking to focus on, and what are the supports that we can provide to do that, right? Maybe I'll pass it over to Mustafa, and I can come back and address some of the AI part of your question, right?
Sure.
Thank you, Michael. I think there are 3 examples where I think we are presenting some AI capabilities within our healthcare services in Microsoft Platform Healthcare, and also in our project Health Insights. So Microsoft Platform Healthcare is a platform for really many of these clinical workflows, care plan, member management, patient management. One of the new artifacts or features that was, I think, in preview right now is readmission prediction. So based on the patient profile, the hospital profile, it's a quantitative analysis of a few parameters to predict a percentage or a score that particular patient is likely to be readmitted, at a certain time. So that's one example. I'm sorry, I'm not very fresh into the details of that example, but the other 2 examples that are rather new and currently also in preview is the new project Health Insight that we recently announced. So that project really has 2 very interesting services. One is called Trial Matcher, and the other one, it's a little bit difficult word, it's called oncophenotype. Trial Matcher is a straightforward. You have a patient looking for experimental therapy, and there is a list of registered clinical trials, and you try to match that patient to the best trial available for him or her. In a literal sense, it sounds like an easy task. What's the patient's symptoms, what's his condition, and what's the trial condition and in question, and then you could match them that way. But then when you go a little bit deeper and you realize, well, if it's an asthma trial and the patient had asthma, that's a very straightforward match. When you look into oncology trials and cancer details and prescriptions and the TNM, if the cancer has metastasized, and the histology and the pathology reports of that patient, it will not be a single code or it's a combination of multiple, the size of the tumor, the location of the tumor, the deformation of the cell, if you will, the type of the tumor that is happening, and how far the spread is with that tumor. And for example, the stage, the cancer stage, sometimes it's written in the pathology report, sometimes it is described, it's not really written. So how could you find that match? That's when the oncophenotype kicks in. That is more of a NLP, natural language analytics and processing, trying really to train a good number of pathology reports to try to abstract the TNM, the tumor size, the number of lymph nodes impacted, and if the tumor was in fact metastasized. So that level of details, once you're able to capture those from the, if you will, pathology reports, and also capture them from the clinical trials inclusion and exclusion criteria, you will be more positioned to make that match. And one of the interesting implications of that, specifically in the field of clinical trials, there is the concern of equity and inclusivity in these trials.
Right.
If a provider is offering this trial for enrolling patients to a certain trial, and that trial is only available in a certain region, maybe there are patients in other region that could benefit even more from this trial. And then there is also the socioeconomic determinants of health, how and where this trial should be recruiting. So having a platform to help enable, I'm not suggesting it will solve all the challenges we have today, but to enable a solution forward, I think that's a great step forward. And I'm very excited to see how this service will eventually evolve and become generally available. As I mentioned, it's in preview right now.
Very interesting.
Remember, we've done some interesting things with AI over the years, but I came across a Canadian company just a couple of weeks ago that I thought was really very cool, right? It's a Vancouver-based company called Canary, and they are working on essentially smart orthopedic implants, right? So they currently focus on knee replacements that have Bluetooth-enabled sensors built into the artificial knee, right? And they built these things, with gyroscopes and accelerometer and the Bluetooth connectivity, all those kinds of things, right? With battery capability that's designed to last 20 years, which is the average lifetime of a knee replacement. But the whole idea of it is that, okay, if you get one of these smart knees for a knee replacement, they can continuously monitor not only steps and stairs and those kinds of things, but are you moving correctly through the rehab, and what is the range of motion through your normal gait, or as you're walking up steps or down steps, kind of thing, right? And so they upload this data daily into their platform. It's very aligned with what you do, Mario, but kind of very specialized. But they're building very robust AI models. The more people that are getting these smart knee replacements,
Right.
the more data that they're building up, and they're building AI models around it, and they're really just starting to go through some validation of these things, right? But that they can based upon the data that they're getting for each individual knee replacement patient, they can really plot with a very high degree of reliability how you're doing through your recovery and rehab, right? You're progressing normally, or are there issues? And if there are issues, they can really understand, are you is that knee moving correctly, or do we need to go through specialized rehab or treatments to get the movement more aligned in the right way, and help the recovery, and basically help that person to get back to a better better movement and mobility, but also in the right way to help that knee last as long as it should last, right? So I just thought it was very cool what they're doing,
That
and
is
very unique.
that's
And
pretty neat.
yeah.
You mentioned a couple of things there that also are part of being able to do readmission assessments, right? But there's also predictive analytics, right, that will be able to basically take this data that's coming in, be able to create some analysis of that data, and be able to then have the medical care intervene sooner than later, right? We're all prone to waiting till it's too late. And so now, again, a big benefit of this big data is to be able to not only do predictive analysis on the individual, but do it across the board for populations, right? So Mustafa mentioned social determinants of health. Here's a whole different subset of data that, I honestly believe in today's age, a benefit of big data is really to help relieve the workload of care providers. Care providers have very little time to really think through everything they've got going on, and they're involved in so much that I think that being able to collect this big data, collect the data from their patients, and then put it out there in a way so that to a certain extent, it can automate some of the decision support that they need to do is of a tremendous value, not only in the care given to the patient and the outcomes, but also in cost savings to these organizations, health organizations, right? And so I'm imagining insurance companies are clamoring for something that's going to create a more efficient system. And it, I probably go back, 20, 30 years ago, and where everything was on paper, and you can imagine all of this big data being on paper. Well, now, over the last 30 years, it's all been digitized. But people couldn't think of, hey, how do I create this interoperability to make this data from social determinants of health relevant with RPM, relevant with insurance data. And so here now we have a huge benefit, which is that in essence we have now the means to bring all that data together into actionable items, services, and resources. So Mustafa, tell us a little bit more about where you see. Let's talk about futures for a little bit. Where do you see this going?
Yeah, I was about to mention that, because me and Michael, we didn't really sync before this call, but he did mention a Vancouver example of a company called Canary, and I happen to have another example of another company also called Canary, but in this case it's called Canary Speech. And before I talk about that company, and by the way, I'm not affiliated in any way, I haven't partnered with that company yet, but I'm really excited about what they do. One thing, Mario, looking into Life365 and the great work you're doing into the remote patient monitoring, RPM, and also the virtual care space, right? So I think remote virtual monitoring or remote patient monitoring, it's been the term for a while now, but I think we need to modernize that term a little bit more beyond that, right? It's not really monitoring the patient, is more of looking into or observing that patient, should or should not that patient have an issue or not, right? So I want to maybe think about it a little bit differently, in the sense that the telemetry or the vital signs that you collect through the remote patient monitoring devices, and in this case, most likely we're talking about the consumer devices, the Bluetooth and the Wi-Fi devices the patient have at their home. Collecting all these feeds is great, but it's great for what? So if the patient doesn't really deteriorate, if his heart or her heart rate is doing just fine, question is, okay, did I just waste my time and technology to collect off your heartbeat and I haven't really done anything with it? Is that where it stops? And I think the answer is definitely no. I would like to look into this more than remote patient monitoring, into a little bit more into biomarker engineering exercise, because these vitals, though they may give you a prediction of what may have happened, for example, a fall detection in some cases on a video telemonitoring. So if I'm monitoring a patient over a video, I could detect a fall through machine learning, right? You could see the physical aspect of the fall registered in a video AI model. So yes, that's good, and that's reactive. If the patient deteriorates, or if the health condition measurements would indicate some concern or some alert.
Mm-hmm.
But then if it doesn't, is it then, what is it then worth for? So I think there is a value more than that. It's really the correlation. So correlating your clinical data set with your physiological data sets, and even beyond with your genomics and radiology data sets, it will unlock a lot of insight and patterns that we probably haven't thought about before.
Exactly.
And what I feel the opportunity is, again, bring it back to Canary Speech, they build a new technology that really look into your voice as a biomarker.
Mm-hmm.
And they have modeled some acoustic and linguistic features to be able to measure stress, mode, and energy level in the voice. And they really hope they could advance the technology to be able to predict maybe certain conditions like depression, dementia, anxiety, or generally your mental health state, just by virtue of analyzing your voice, right?
Right.
Another attempts, I know there are multiple papers in the space with gait analysis. So with, for example, with Alzheimer, there are some patterns in the gait that would indicate an onset or a progression of Alzheimer.
Mm-hmm.
So by analyzing your gait, you may be able to learn a little bit more about the onset of that condition.
Yeah.
So I think the message I want to leave with, yes, remote patient monitoring is important, but it's really thinking about, you're holding your chest really tight. I hope the patient doesn't really fall apart or something bad happens. It doesn't have to be that way. That data is important, and they are probably going to contribute unlocking a new insight and a new knowledge when combined with other data sets.
Great point. The medicine always looks at the historical history of that patient, right? They're looking backwards. Now we're able to actually do real time, right? And now things are progressing to where now we can look into the future by using all of this data that's being created, as you mentioned, and then being able to act on it, right? And potentially if we're not doing it now, I'm sure it'll be here very shortly, is to be able to intervene before anything gets too far down the road, right? And so, before anything turns chronic, to be able to access something that can be changed by not necessarily pharmaceuticals, but by diet, by exercise, by being able to do that. And so definitely that's something that's going to be hugely important as the use of big data goes forward. Michael, would you like to comment on that?
Yeah, I was just gonna say, as long as you and I have been at this, Mario, in particular, right? It's kind of astounding how much has changed, through the pandemic, right? How much that really accelerated, new ideas and innovative thinking, and we're still coming out of some of the aftermath of that, right? But there's so many, kind of trends converging now, and so much innovation happening that, was moving at a snail's pace before, right? And I think a lot of the themes that we're talking about, I sort of come back to that shift left, right? It's okay, how do we bring all this data together and continue on this path of, new models of healthcare that are focused on, keeping people healthy and keeping them, out of the more costly parts of the healthcare system, and or how do we help them, get back into the home environment, or get back into long-term care and recover with that, continued monitoring and support and communication and engagement, and and still provide the support system to accelerate the healing, but also save cost, right?
Exactly.
Maybe one other example I could throw in, again, a company I came across recently called Newtopia. They're a Canadian company, and I'll say, like Mustafa, this isn't a company that we're working with directly, but I was just really impressed with what they were doing in related to health and wellness, right? They've essentially created a very highly personalized service that their customers are health insurance companies, or very often self-insured, large companies that self-insure for their employee benefits, right? But they have a very highly personalized plan, and they build on AI models and big data and all these kinds of things, right? Around, okay, really understanding, patients that are willing to enroll in their wellness program, right? And they'll, go through, and I think they even get into genetic data and understand, the history and, any health concerns related to the customer. They do a lot of, with things like mental health and obesity and those kinds of things that, can be treated through, with proper coaching and support and, and engagement and social interaction, right? So they have a whole platform that does this, but, they're, which is very exciting to see, kind of that focus on wellness instead of reactive healthcare. But also, what was interesting to me about it was the business model, the financial model that they had around this, right? Is they can prove, and they even guarantee, right? Okay, that the costs that, the customers will spend per patient are about half of what they would spend if they don't engage the program, right? So if you let these conditions get worse and lead to more complications and more costly, reactive problems down the road, right? If you do it proactively, they can prove that it's about half the cost, and and they build their pricing and their business model around that, right? So it was very refreshing to see that, right? After
totally interesting, yeah. And it just brought up in my kind of boning up for the session. One of the things that I really think that you both touched in a way is, in essence, big data is really is basically making this information, this data, this ability to intervene on health and wellness across the spectrum of social economical. So what is being brought to bear here, you mentioned it earlier, is you've got different populations. We have so many different illnesses that are focused on populations that need to be addressed, right? And they're not. And so when you're able to bring in the social determinants of health, for example, again, and bring those to bear, then now we've created our I guess what everybody's dream is that big data is really going to be the first step in creating the great equalizer, right? Which is that access to health for everybody, and being able to put it at the fingertips of those that need to be aware of it, be it the patients at the end of the day, but also all of the myriad of care providers, specialists, the pharmaceuticals, all of the professionals that really are in this value chain, right, towards providing better outcomes for patients. So so we are now at 15 minutes till the top, and I think we could have gone on for another hour or two, but in the interest of time, let me just double check, see if there are any questions out there on the chat. So participants, please, if you have any questions, go ahead and add them to the chat, and we will answer those for you. I see so far we got off pretty easy, but no open questions at the moment. Just then a reminder, if you do have any questions of any of the panelists, please feel free to contact us directly. You can contact them through me if you'd like, and we will be very happy to get back to you with those answers. So I would like to thank our panelists today for a great session. Like I said, I think we could have gone for another hour, but I think we've got some interesting information out there that we shared, both Mustafa and Michael. I really appreciate it.
Sorry, Mario, before we close up, I think one of you has their hands up.
Oh, there we go.
A panelist.
Popped up. Hello. Oh, chat is disabled. Let me check. Kendall, could you please check that for us? Go
Yes,
ahead and
it
ask
looks like
the
they go ahead and ask the question in the Q&A.
I can actually do an answer. Yeah, go ahead and answer it in the
Q&A
Q&A
section.
Yeah, so if you want to type it in there, and I will see where the Q&A. Oh, I've got them now. So let's see. Still don't see the question. So I think we're good for the moment. So Abanis will be, you drop us an email address, we'll go ahead and correspond. But alrighty, well, again, thank you all participants for participating in this session of the New Normal. We've got some new sessions coming up very soon, so please be on the lookout for the invitations. And to my panelists, Michael and Mustafa, thank you so much. It's been a pleasure talking to you. Oh, wait, I just saw the
question.
Yeah. It said there, the question is, what about using AI to correlate the RPM measured data with big data for early detection? Mustafa, would you like to answer that?
Yeah, I'm happy to maybe I don't think there is a straightforward answer for it, but I'm happy to share some examples of how that may be the case. Sure. I mentioned earlier fall detection. So fall detection can be accounted for or detected again retrospectively by video monitoring. So you would know the patient just fall because you saw it, and you have a prediction AI working on that video feed. But there are other maybe wearable devices that could, based on the gait, the heart rate, maybe the path the patient is walking, so maybe the telemetry or the GPS movement of that patient. There is also some gamification activity exercises that the patient should be doing on a daily, on a weekly basis, from which you could see the progression or deterioration of the condition, as an example. So these are all, I think, aspects of remote patient monitoring beyond the heart rate and the step count. So we need to think about them a little bit, in a broader sense, but also in the clinical sense and in the scientific sense, as we all know. There is a little bit of work that needs to be done to distinguish correlation and causation, right? So I think being correlated with another thing, it doesn't mean it was the reason for it. It may be just a mathematical correlation. So that's a little bit more of a, that is the health science discipline to distinguish that. And that's the opportunity and challenge that lies ahead. How much correlation we could define as a causation, and how much of that is not actually a dependent or an independent variable in that equation. It's not a predictable variable, if you will. So I think that the physiological data sets, the audio now we have learned, with the voice, there is a lot you could learn about the mental state just virtually by the voice of that patient. And then the physiological data sets. I think that correlation definitely can help inform and train AI models.
Yeah, definitely. So being able to measure real-time RPM data can actually be correlated against historical population data to be able to see where that patient is on their health path, right? So again, if there's any indicators that they're deteriorating, they have a chronic illness, they'll be able to map those out and get real data, big data from big data that will be able to help correlate that. Michael, did you want to add anything else to that?
I was going to say, I was with a customer a couple of weeks ago, right, here in Ontario, right, and a very large regional health system, right, and they were working on a cardiac early warning system, right. It's not a project that we did, so I don't have a lot of details of it, right, but they were building up AI models around bringing different parts of data together, certainly the patient's clinical profile and the ongoing biometric data, and through this early warning system algorithm. Again, I may have my facts wrong here, but I think they completely eliminated the code, whichever color it is, right? Code blue or code orange or whatever, right? Related to heart, serious heart conditions within the hospital, right? So, I think whatever number they had before, they had totally eliminated that, but they were building up this algorithm, moving towards all the trends that we're talking about, right? Is okay, well, for patients with heart conditions that come to the hospital, and we're looking to reduce costs and free up beds and provide a better recovery environment for the patients in their home or in the long-term care facility, right? But can we combine a lot of the technologies that and data that you bring to the table, Mario, right? And build those AI models around early warning systems to identify situations developing long before they're a problem, and in such a way that the appropriate interventions can happen, and avoid the readmission or avoid the recurrence of the problem, right?
Definitely.
The potential is amazing, right? And there's all so many cool things happening in this space right now. And
indeed, so much to talk about and so little time, right? So
that's right.
So good. All righty. Again, thank you, panelists. I really appreciate it, and thank you, audience, for your participation. And we'll look forward to the next new normal. Have a great rest of your day and great week. Thank you very much.
Thank you, Mike.